Hello, everybody. Thank you so much for joining our webinar today on the expanding role of consumerism in healthcare delivery. My name is Jenny Fine, and I'm a program manager with Rutgers Business School Executive Education. I am pleased to have with us today Ron Guido, who is a real expert in all topics related to healthcare, pharmaceuticals, life sciences, and has vast experience in many functional areas in those industries at a very senior level. I'm going to turn the reins over to him in a moment so that you can hear the presentation you signed on to hear. I just want to let you know a couple of quick housekeeping matters. The first is we're going to hear Ron's presentation for approximately 40 minutes, and then there will be an opportunity for question and answer period. Please chat in your questions using the online chat option that's part of your screen for GoToWebinar. You should have a screen where you can see that you're on and who else is on. There's a chat box there. Go ahead and type your questions in. At the end, I will read those. Ron will respond to them, and we can have a dialogue in that manner. If we have a real opportunity to do this, we can also enable people's audio so you can speak directly, but I think we'll get started using the online chat. I am recording the session, just so you know, and I'm going to turn it over to Ron. He'll tell us a little bit about himself and then move through the presentation. As I said, then Q&A, and then I'll do just a brief wrap-up at the end. Thank you so much for joining us, and enjoy. Ron?
Thank you, Jenny, and hello, everyone. Thank you for taking time out of your day to join in this conversation, and hopefully it will turn into a conversation about one of the moving parts in healthcare delivery these days. When we say moving parts, I think everyone on the call could probably agree that healthcare is changing in so many facets, whether you're a provider of care, whether you're a manufacturer of products and services, whether you're involved in the regulations or in the payer side. It's a very dynamic sector of society. It's growing to be the point of about 20% of our gross domestic product here in the U.S., and there is no one perfect model as you look around the world between public and private healthcare systems. Everyone is searching for the right equilibrium in healthcare. Later in the program, Jenny will tell you about a Rutgers Business School program that's starting early next year, which will really address strategic healthcare specific to the management of practices. So we're particularly interested in those of you who are in the practice management side of healthcare on this topic and others that you'll be exposed to through the Rutgers program. But today, as a teaser, we're going to talk about the expanding role of consumerism in healthcare delivery, one of those dynamic pieces that just sort of invades healthcare delivery, and we're all facing it. We're all partly responsible for this role. Before we get there, I'd like to just share with you my background. I'm a private consultant now in healthcare marketing, particularly emphasis on supply chain management because it is about the delivery. My pedigree is with Johnson & Johnson for almost 4 decades in a variety of functions, but most of those functions have been patient-focused or focused on the healthcare providers. And now I'm an instructor in the Rutgers Executive Ed program. These two icons here on this next slide is really to provide that introduction to why we believe consumerism is overlapping now with healthcare delivery. So these are two iconic symbols of what's happening in our society. Certainly on the right, you have the symbol representing healthcare and doctors and nurses and the care providers. And on the left is probably the most dynamic name in consumerism, where almost everyone that I know is a user of Amazon or Amazon Prime, and how they are changing the face of consumer goods delivery. But here's what we see as a backdrop to this topic, that the sanctity of the traditional doctor-patient relationship or nurse-patient relationship is really changing, and it's being influenced by the connectivity of patients and consumers of healthcare to social media. patients and their loved ones are talking to people online in affinity groups, sharing their experiences, medical information, and with all due respect to HIPAA laws in the United States, people are willing to share their conditions and their experiences with strangers because of this need for affinity to what can I expect, which caregivers do I go to, what are the things that I might not hear by talking to my doctor that I might hear from strangers who have had both good and bad experiences. And then the other dynamic, which is very interesting, is that the demographics of our society are changing with a strong bias to electronic commerce generated by the Gen Y patients. There are about 76 million millennials now in the workforce, and they're consumers and purchasers of healthcare delivery. But the big question mark here is, as a result of their presence in these social media connect groups, affinity groups, there's an enormous amount of unregulated or content on the internet, unregulated or at least unvalidated, and that's what's invading these medical affinity communities. The one topic that we're going to focus on for most of the time we have together is telemedicine, because the use of telemedicine services are really growing at an exponential rate. And everyone seems to be aligned to say, yes, this is a good thing. However, again, back to the regulations, how do we govern this segment of healthcare that's really ill-defined right now and just evolving? So this is the backdrop of why consumers are invading healthcare delivery, but how do we manage it to make it a good thing and not a troublesome thing? Speaking of the Gen Y consumers, they like alternative care options. They're not satisfied with, you know, it's not your dad's old healthcare system. This may be a generational phenomenon, but they're looking for quick fixes. They're looking for alternative care options, and they're looking for much more information. This is validated by a couple of studies. According to the Pew Internet and American Life survey in 2012, a little dated, about 40% of Americans manage their health care using some sort of mobile app. And what's telling about this is it really was only 17% back in 2010. So much more aggressive penetration of Americans seeking health care. Their first inclination is to seek health care information by picking up the cell phone. And according to the Physical Times, telemedicine has already been used by more than 36 million Americans, and we'll define what we mean by telemedicine in a few minutes. Another interesting stat is that 70% of doctor visits can now actually be handled over the telephone for this, you know, maintenance work, follow-ups, just general questions, as opposed to care, which is patient to doctor or patient to nurse, where there's involvement. A friend of mine, Dr. Mark Blatt, who heads up the medical side of Intel, is in the near future we'll see more office visits conducted in the living room than the waiting room. So remember that soundbite and see if that comes to pass in the years ahead. But we have to question this. We have to question the future of healthcare delivery. The first question is, can the healthcare industry maintain its excellent quality standards, assure protocols are followed, and how do we certify and recertify providers while consumers are shopping aimlessly at times for these remedies? So how do we control a regulated industry that's now going the way of many other consumer functions in society? How will this consumerism in healthcare shake the foundation of things like public health policy, state policies, and regulated care? Will the likes of Amazon and Google become the new supply chain of patient care? We all know about Google Health, and Amazon's permeating our society with delivering almost anything to us. How do we harness the power of these organizations and others like Walmart to really be part of that supply chain? And it is happening, obviously. You can go to a local pharmacy or even to Walmart and get some light-duty healthcare delivery right there with with medical checkups and so forth. Big question then, will consumerism eventually lower the cost of care, maybe even increase access to care while accelerating the acceptance of other forms of medicine, homeopathic solutions, and of course care through telemedicine? So that would be a good thing if the three issues that affect healthcare now is the high cost of care, limited access, and of course outcomes, if they can all be improved by virtue of managing this consumerism impact. So the last question would be, when you talk about the for-profit companies that are playing in this space, will they continue to apply good conscience and use clinical data in deciding what protocols should be administered and promoting this consumer-driven healthcare modalities? Empowering consumers through the new medical delivery models, this is just to get some definitions. We'll be hearing more and more of this in the years ahead. But consumers are motivated, and that's the key. When consumers are motivated by something, it does change the game, at least in other industries, and we'll see how it affects new delivery models. Things like self-care, choice, and not have to follow what your insurer tells you have to do. Eventually, we may get to personalized care, personalized medicines, and so forth. It's certainly more convenient to get health information on a mobile device than going to a care center. And then how does this impact health insurance reform, and where does the access to new technology now play a role? There are many different definitions of what we're talking about, but the primary one being telemedicine, which simply stated is the use of medical information exchange between sites via electronic communications, ideally to improve a patient's health status. Telehealth is really the use of electronic information and telecommunication technologies to support long-distance clinical care, including patient and provider education. That's been around for a while, and we will talk about how telecare, for instance, has been a great way of reaching the physically challenged, the shut-ins of the elderly and so forth, providing care and reassurance to remain living in their homes. And this is particularly valuable to the loved ones of those elderlies who may not have access to their relatives or to care right away. So the good news here is the providers are on board. Some of the studies would suggest that the providers see the value of using telemedicine and alternative care connections to promote their options, their healthcare options. 89% of primary care and internal medicine physicians use smartphones to communicate with their staff. Well, that's probably no different than any other business sector, but it is in healthcare as well. 70% of doctors viewed patient data on mobile devices. So as they're running between clinic and hospital and office and maybe even home visits or nursing home visits, they're checking their mobile devices and looking for that information. 65% use mobile devices to look up non-patient health information, just to double check perhaps the indications and contraindications and warnings of medicines and so forth. 51% use tablets to access independent medical references and perform internet research. 48% use mobile health devices to educate and train those around them. And lastly, 42% use mobile devices to obtain clinical information. And this is just a nice microcosm of functionality. It'd be interesting to go back to the same survey respondents over time and see how these numbers grow. But you can see there's a trend anyway for providers to be on board with telemedicine. Is it cost effective? A 2008 to 10 study reported 160% ROI when companies used telemedicine compared to those who did not. 2008-2010. More recently, in 2011, a study of chronically ill patients showed a 30 to 53% annual savings in healthcare costs due to telemedicine coordination of care and protection which then allowed providers to be alerted to changes in patient status and intervene more quickly. Again, I don't know the background of the study, the construct of the study, but at least directionally, we're looking at saving from reduced costs due to early detection using telemedicine devices. And then most recently, in 2012, Johns Hopkins conducted a study that shows that the quality of care and even the clinical outcomes were equal to or even better than in-hospital care, and garnered a savings of 19% when it comes to the cost to inpatients. So it's cost effective, and if we avoid some of the pitfalls discussed a few minutes ago, we can look forward to excellent quality of care, timely care, and still achieve the clinical outcomes that you would from an inpatient setting. There are legislative barriers, and quite honestly, both the federal government and the states are slow in adopting or recognizing how these should be legislated and regulated. Government and even the insurers have been slow to provide adequate reimbursement to telemedicine. On the federal level, there's a new bipartisan group based out of Washington, the Alliance for Connected Care. They dedicate themselves to looking at reimbursements for telemedicine and broadening the number of providers and services that are covered, looking forward to unifying national standards in this category. The state levels are still more of a mosaic of regulations. They differ greatly in allowing the use of telemedicine. We don't really have a lot of multi-state licensing and medical certifications, the so-called reciprocity, where a doctor based in one state can provide telemedicine consult to someone in another state. And that's even including writing scripts. That is changing, I will say, and I think there's this gravitational pull towards harmonizing the states around telemedicine with the proper rules and controls, of course. So just to conclude this portion of this dynamic in healthcare and how consumers are influencing such change, we could say that telemedicine and mobile health will become a significant part of the future for healthcare delivery. It's happening, and there seems to be very few roadblocks that can stop it, stop this wave of interest on the part of the consumers. It focused initially on helping physicians serve rural areas, or like I said, patients that are not accessible to them, but also physicians were using telemedicine to consult with specialists on a particular situation or a patient's condition. So that connectivity had been pre-established. But looking ahead, the next steps will be more consumer-focused uses for remote primary care, concierge services, which I guess seems to have peaked a couple of years ago, and there may be a resurgence of that with new technology. Child care, prenatal care, and also follow-up visits, which may be routine. And we all get anxiety as patients when we have to go for a follow-up visit or to just get the diagnostic results. Well, a lot of that anxiety can be mitigated by using telemedicine for situations where there's a benign situation. It's a cutting-edge future of healthcare worldwide, not just in the States, with the potential, as I mentioned, to improve all three segments of healthcare: lowering the cost, improving access, and hopefully improving quality care. If for no other reason, the timeliness of information being shared over telemedicine channels. And then lastly, telemedicine will predictably be a key service available in the next generation of healthcare consumerism. So the infant in the upper right-hand corner of this page would probably be looking at, tell me again, Grandma, why you didn't have telemedicine before. So I think we're seeing this change. It's one of those moving parts in healthcare. There are many others, obviously, but this is one that can't be denied, that we as consumers and we as patients are becoming one and the same consumer of goods and services, and coupled with the Gen Y bias towards instant gratification, and I want it now, and I want it now, and I want it accurately. I can't see any reason why we're not going to see more adoption of these telemedicine and mobile health services. So thank you. That's all I wanted to say. Maybe some of this is provocative and might whet your appetite for challenging these trends, or even commenting on, yes, it could work, but it would only work under these circumstances. I know there are some providers on the call. I'd be anxious to hear your thoughts on this topic and even your experiences with telemedicine. So Jenny, I guess we can ask for questions through the chat function on the GoToWebinar side panel.
Yes, absolutely. People can submit questions through the chat panel. And I'm going to give everyone a moment or two to do that, and then we'll start to queue them up and read them out loud and address them. Okay, one question that came in was, are medical sites like WebMD and MayoClinic.org reliable? So why don't we address that for a moment?
I think the general answer is yes. Compared to maybe a Wikipedia where anyone could add content, it is vetted. But I think when you're looking at sites that have the backing of prestigious institutions like the Mayo or the Cleveland Clinic, for the most part, the general information that comes forward is accurate and validated. However, we all know that when it comes to personal health care, everyone is different, and everyone has different medical histories, genetics, lifestyle, and I don't think an accurate diagnosis can be done by those sites. That's where your primary care provider has to come in. And so it's good for directional information, but not for deciding on healthcare therapies. Okay, great. And I'm taking a look, and you can keep chatting in your questions as we're going through these. Another question we got was also related to telemedicine. Do you believe that telemedicine will continue to grow in acceptance by the authorities, or at some point will consumers maybe negative experiences, because there will always be some of those, lead to a reversal of this trend? That's a great question. It's both. I really do think that we're going to have fits and starts, and the minute that there's a bad outcome, it's going to cast a shadow on the entire segment of healthcare, and people are going to possibly shy away from telemedicine. But I think if it starts with the simple things, like the follow-up visits, like exchanging information and not trying to determine, which surgical modality to use on a patient, I think it's going to continue to grow, again, driven by the demographics of the next generation and how comfortable we all are in using mobile devices to seek information on any topic. So I think it's going to continue, but it's going to have its challenges, particularly in the legislative and regulatory area. Tort reform, perhaps, and the liability. If I'm a provider, which I'm not, I'd be hesitant to give too much direction to someone who I don't know, haven't touched, haven't seen, don't know their vital signs. So I don't think telemedicine is ever going to replace the value of a patient and doctor, or patient to nurse or PA experience. Okay. I'm taking a quick look. I'm trying to ask the order that they were received. Let's see. Okay, looks like one more question came in a moment ago. You mentioned Google and Amazon possibly playing a role in the health movement. We talked about that a little, but I'm curious if you have any further insights on that. Well, there's a whole product side that when product has to reach that consumer slash patient, I think we're good in that department, right? The Walmarts, the Amazons, and so forth can expedite the delivery of approved medicines that have been prescribed properly. They can get them there. I don't know if the drones are going to do this, but I still think the mechanisms that are being set up that deliver, groceries and consumer goods to households can also be the channel where healthcare products are delivered. When it comes to the likes of Google, it may be a little bit too idealistic, but I think with all the medical research that's being done around the world in pockets of universities or in corporations, I think the likes of Google have the best chance of harnessing that information, aggregating data, and maybe find some discovery. So I think that Google as a search engine can help us more in the future than they have in the past with insights into slices and dices of clinical information. But Google Health had some problems in the get-go. I mean, they aligned with reputable institutions and they had the right thought in mind, and maybe it was too soon. So I think there's still a lot to be said for, solid clinical data coming out of a controlled study on a particular disease state for a given population, and that will continue to be the norm for the foreseeable future. But I think as for mining insights on healthcare and maybe softer things like the relationship between lifestyle and long-term health, I think Google can play a great role in that going forward.
Terrific. Thank you. Okay, any other questions? Those seem to be the main questions that came in, but we still have another opportunity. Ron is going to show a slide that I'm going to speak to regarding next steps.
Well,
if you've enjoyed.
Jenny, we have a few more questions that are lined up.
Oh, I'm sorry. I'm not seeing all of them, and I don't know why. Todd, do you want to cue those? I apologize.
Sure. So the first question is, how do you think urgent care centers fit into this picture?
Okay, so urgent care centers, they fit in from the standpoint of their initial design. Think about this Gen Y, and I apologize if any of you on the phone are Gen Y, and it seems like I'm picking on you. But from watching my kids, they know what they want, they've researched it, and they want delivery. And I think the urgent care centers, or even the multi-specialty physician offices, can provide that quick delivery of healthcare needs. So I think they will grow. I think diagnostics in those centers are going to grow, but certainly urgent care. Just like the value of an Amazon, bringing goods closer to the home, whether it's a kiosk in the neighborhood or directly to the doorstep, I think urgent care centers and smaller group practices are going to be preferred by the next generation of consumers.
Great. The next question is, how do you think discussion and/or affinity groups impact the conduct of clinical trials?
Yeah, tough question. I don't know. I think they might set the stage. The affinity groups, and those of you who may not be aware, we're talking about online communities that go deep into a topic. So they might talk about, what signs are there that you need gallbladder removal, So the affinity groups will set the stage for it, but at the end of the day, when it comes to the modalities of care, whether it be a medical treatment, surgical treatment, watchful, watch and see, wait and see, I think those are still going to be driven by the clinical trials. And, the FDA is trying to accommodate shifts in society and healthcare, but personally, I hope they don't loosen their grip too much on the clinical trials that have proven medicine.
Thank you. The last question would be, can you suggest potential cost models for telemedicine interactions?
That's a good question. So I think if we can, it's still a fee-for-service model, unless you're in a concierge environment where you just, it's like the country club approach. You pay a fee for the year and you get unlimited access to telemedicine care. I think the fee-for-service model is still the best measure against the non-telemedicine modalities, because if we are trying to measure outcomes, access, and cost, we want to try to mimic the traditional model as much as we can. So I think ultimately there should be a reduction in cost due to the fact that you don't have all the infrastructure to support in the traditional model that you would not need in telemedicine model. But as far as overall cost of care, I think it remains to be seen just how payers are going to respond, what people are willing to pay out of their pocket for the advantage of a telemedicine episode of care. So I think you might see a new set of codes, perhaps, with different reimbursement levels, depending upon what is tried and true from a telemedicine standpoint. Yeah, well, the question came in like, okay, so there's been the setbacks from Google Health. What can we learn? Well, I'll be facetious and say that maybe the future of healthcare can't be designed by 25-year-olds sitting out in California, and they need to be integrated more with, the traditional healthcare professionals. So I think if you're looking at how do we take the traditional model and clean it up and freshen it up, I think Google could probably give us that sense of innovation and what's possible. I personally, I'd love to see automated cars where we don't have to drive and run into each other. So what can Google Health do to bring care down to, more consistency and so forth? But it's going to take the consultation, the guidance from the traditional healthcare. And remember, when we talk about healthcare, we're talking in the end-to-end healthcare, from research and development through the manufacture of products and services, all the way down to primary care and tertiary care centers. So we're talking about a full continuum of innovation and change that has to take place, and Google Health can't just drop in and say we're going to design the new healthcare. So I think the one learning is it's got to be done in concert with traditional medicine.
Okay. Thanks, Ron. Jenny, that's about it as far as questions are concerned. Should I throw it back to you?
Yeah, that'd be great. Thank you. Ron, can you just push that one next slide, please? Okay. Thanks so much to everyone who attended today and hung in with us till the end. I hope that you learned a lot, and I'm sure you have some things to think about as you go back to your regularly scheduled day. This was a great example of some of the really quality, relevant, timely topics that we cover in our Mini-MBA programs, many of which Ron teaches in. You can meet him live and in person. The two upcoming programs we have that are of particular relevance to the topic we addressed today are a program in strategic healthcare management for practices and a Mini-MBA, another program for biopharma innovation. I'll take just one moment to talk about each. You can see the links in front of you to visit the program pages, learn a little bit more, and hopefully decide you'd like to contact me for more information or go ahead and sign up. The Biopharma Innovation Program is designed to provide a holistic view of the business realities in which the life sciences and pharma industries operate today. A lot has changed, a lot is changing, and people who work in one functional area in the industry might feel like they lack a full big picture understanding of what the world around them is like and why decision makers around them are making the choices that they're making. So the Biopharma Innovation Program really fills in those gaps, gives you the vocabulary and the context to understand the big picture of the industry, whether you're looking to move to a different role and feel like you're a little pigeonholed. Maybe you've been in the lab for a long time and are looking to move to the executive suite, or if maybe you've worked in another industry and would like to move into the life sciences industry and just need a holistic view. That program is running for a full week in New Brunswick, the week of October 26th. We do still have some spots available. The other program that is of interest to our topic today is a program in strategic healthcare management for practices. That is a program that's designed for people, whether they are actually healthcare providers or administrators, who work in practices rather than institutions. We're not targeting hospital executives in this program. We're really targeting people who work in medical or healthcare practices of any kind, dental, paraprofessional, wherever you might fall, and whatever your role is there, again, to understand what it takes to be successful in a non-institutional practice in this day and age. We're going to cover a lot of very relevant, timely things, obviously related to regulatory matters. Certainly, the Affordable Care Act will feature prominently. We'll talk a lot about the legalities of having a practice, adverse effect reporting, records maintenance, security of records, things of that nature, in addition to some brass tacks, back-end office operational things like accounting for healthcare practices and things of that nature. There's a discount code up that you can see on the screen. Should you decide to register, we're happy to extend a discount to you. My contact information is here. I welcome you to reach out to me at any time. I'm happy to answer questions, take suggestions, and I do hope that this has piqued your interest in learning a little bit more through some of the classes that we offer from the Rutgers Business School. I will ask one more time if there are any last questions before we wrap up. You can go ahead and chat those in. Todd will keep his eye open. Okay, then I will thank you one last time for participating today. I hope you enjoyed it and learned a lot, and I'll hope that we can be in touch soon. Have a great day, everybody, and thank you, Ron. Bye-bye.